Congratulations, you're now on solid foods. You're probably around about 4 to 6 weeks after surgery. However, some patients will take a little bit longer to progress. The main thing you want to watch out for at this point is, are your soft foods going down without any discomfort? If they are, you can move on to the next solid phase. During this phase, there's lots of trial and error. We're starting to expand the textures in our diet, but also the variety of food as well. It's really important to keep mindful of your portion sizes at this point. We'll still be on that quarter cup portion, which is around about this size. And you might find that as you increase the texture, you might need to decrease the volume that you're eating just temporarily. As time goes on, you'll gradually be able to progress to around about a cup in volume at your meals, but this will take about 6 to 9 months or so, depending on the person. So really just take that nice and easy. Now, as we progress onto solid foods, it can be a little bit daunting to know what to eat to get the best out of your surgery. We get it. Let's keep it nice and simple going forward from here. Now, we have had quite a big focus on protein foods up until this point, and these are still very important. So we do need to include those in our diet. What we want to do is cover about half of your portion to be some sort of really good quality protein food. So that's your unprocessed meat, so things like meat, chicken, fish, but there's also lots of non-meat options as well, such as beans, legumes, tofu, that kind of thing. If you need more advice on this or clarification, do ask your dietitian or nurse. What we don't want to forget at this point, and what is really important, is your sources of fibre, so food sources of fibre. So the rest of your plate really wants to be covered with lots of high fibre foods, and the best ones to go for here are your fresh fruits and vegetables. So things like salad greens, capsicums, cucumbers, all of those really lovely colourful things are great to add on the rest of your plate. In terms of carbohydrate foods, they can be a little bit controversial, or quite a controversial topic around weight loss surgery. Now, what we don't want to do is add too many of these into our diet, because they can take the space of the other quality foods, which are your protein foods and your high fibre foods. But at the same time, we don't want to deprive ourselves of these foods, because as soon as we say we can't eat something, that's what we want to do is eat more of it. So when I say carbohydrate foods, these are things like bread, rice, pasta, those sort of really bulky carbohydrate foods. They can give us a little bit of value, but like I say, for some people they take the space of the more quality foods, and for other people they can be a little bit weight promoting. So hence we just want to watch how many of those foods come in. So if you do add them in, maybe just do it for 1 or 2 meals per day or less. And always eat that portion last, and it should be the smallest portion on your plate as well. Again, if you need any more clarification around which foods fall into which food groups, definitely consult with your dietitian. You may find at this point, when you're trying new foods, that some foods work and some foods don't. That's okay. If something doesn't work, hold off for a bit and then try it again a little bit further down the track. If you have persistent problems with food tolerance, do get in touch with the team. Now, looking longer term, meal planning can be really important to keep your food intake on track. But we want to keep it nice and simple. If you've never done any kind of meal planning before, don't go, full blast into it and plan out a 7-day menu. That's unrealistic, and you're not going to stick with it longer term. So just plan a few days out at a time, maybe 3. Keep breakfast nice and consistent to make it nice and easy. Maybe rely on leftovers for your lunch. And just plan in 1 or 2 new meals, and stick to some of the basics that you know for the other meals, so you don't feel as overwhelmed. And this can help you sort of longer term. As time goes on, you'll build up your library of recipes, and you'll build up your confidence to maybe expand that meal plan out to a couple of different days. The main thing here is making your meal pattern, food choices, and meal planning easy for you and nice and simple so that you'll stick with it longer term.